our military remains ready and continues to operate around the globe. That includes providing personnel, supplies, and support to the public health crisis here at home. Our top priority is the safety and protection of our troops and families from COVID-19. Every day, leaders across the service balance mission requirements while protecting our service members' health, and I believe we're striking the right balance. Our military continues to support the whole of government response to COVID-19. So Secretary Norquist highlighted some amazing numbers, but I'm going to take a different direction. Before I went to sleep last night, my wife and I watched episode 2 of John Krasinski's Some Good News, the SGN network online. And if you haven't seen it, look it up. It's worth your time. There's a lot of good news out there. So I thought I'd share some of the good news from our perspective. I'd really like to highlight some of the stories of our people, because we have almost 50,000 deployed right now on this mission, and over 30,000 are from the Guard and Reserve. So, a guy named Colonel Hans Otto from the 45th Airlift Wing in Ohio put together a group of 7 volunteers. He's a reservist. They called themselves the COVID Commandos. Just 4 days ago, on the 5th of April, their team, 1 doctor and 6 nurses, packed their bags, said goodbye to their families, deployed to New York with 24 hours notice. Incredibly, one of those 7, Lieutenant Jennifer Garretson, only had 6 hours notice when one of the original team members was unable to make it. These 7 great Americans are now working today in Lincoln Hospital in New York. Their deployment is part of a larger mobilization package of more than 1,000 reserve medical professionals from across the nation deployed to New York over the last few days in support of COVID-19 response to take care of their fellow Americans. So here's some word from Lieutenant Garretson. She was covering a 12-hour overnight shift in the intensive care unit at the Wright-Patterson Medical Center near Dayton, Ohio over the weekend. She says, quote, "They called me during the shift and asked me if I was willing to go, and I said yes, so I thought I was going to leave on Monday." She finished her shift at 6 a.m. on Sunday, went home to her family. 3 hours later, she got another call, and so she says, "When I hung up the phone, I just looked over at my husband. I told him, they want me to leave today." So he said, "Let's go get you packed." And she was on a plane that afternoon on the way to New York. And the next day, she's going to work in the New York City hospitals. And there's been thousands of stories like that since the President mobilized the reserve on the 27th of March. Think about it, 27th of March is not that long ago. And now we have thousands of reservists, medical professionals deployed all over the country, but in New York in particular, from their normal life at home to the middle of New York in hours or days, right to work, leaving their families, leaving their homes, running towards the trouble. They're moving fast to help their fellow citizens in a time of crisis. They're helping to support the heroic doctors and nurses already there who are tired, who've been fighting that disease for the last few weeks, and they need support. And that's what they're there for. And it's just a few examples of the sacrifice that citizen airmen, citizen soldiers are making from all units in order to fight and improve the lives of Americans. The U.S. military and the American people are incredibly resilient and thrive under adversity. And I want to assure you that the impact of COVID-19 is felt across every component, every service member, every element of our nation, but we'll continue to confront the pandemic head on, and we'll be even stronger after this is over. So I want to close by crediting all our servicemen and women, the 50,000 in harm's way right now, especially those reservists and guardsmen who are running to the sound of trouble with almost no notice. I want to recognize each and every one of these great people who are in the fight, because a nation's strength comes from its people. Those who have had the privilege to wear the uniform for our country are sworn to support and defend the Constitution, the nation, its people. We've done it for over 250 years in times of war, in times of crisis, in times of emergency, and we're going to do it again in the face of this pandemic. So when we work with FEMA and the other interagency partners, we're going to prevail in the end. So with that, we're happy to take your questions.